Thank you. So, good morning, everybody. I am Delmastro. I'm a senior researcher of the Institute of Informatics and Telematics of CNR in Pisa. If the presentation starts, no. Okay, we continue to talk about aging. But in this case, this presentation is related to a project that is much smaller than the previous one, because it is a sub-project inside the spoke tree, that is the spoke of the Tuscany Health Ecosystem dedicated to advancing technologies. And and it is a pilot study. So what we have done until now here, and the focus of this project, is to analyze the impact of adapted physical activity and behavioral analysis on active healthy aging, and we try to move towards the people, to the target population that we want to address. So the project is called Active Aging at Tuscany Health Ecosystem, and the target is to deploy an ecosystem of multi-domain monitoring systems and to provide personalized support that are based on wearable and personal mobile devices, together with personalized program of physical activities and cognitive activities in order to delay the negative effect of aging. So this framework implements a full person-centered approach, and we want to validate the clinical assumption that adopting healthy behaviors and improving the physical activity, we can fight against the aging, but also we want to use this study to validate our research on AI applied to the data we collect in the pilot. So one of the main focus of the pilot is for sure the collection of large data sets. It doesn't work. Okay, sorry. So we focus on the physical and cognitive well-being. So we are not really talking about diseases, because we want to address mainly healthy older adults. So people that are over 65, that are not affected by specific chronic conditions. And we define a protocol, a study protocol, that is based on initial, intermediate, and final clinical evaluations that are made by the medical researchers that are involved in the project from the Institute of Clinical Physiology in CNR. And we integrate this type of information with the daily monitoring of sleep quality, nutritional habits, and physical activities. Together with this, we make some specific intervention. We enroll some personal trainer to define some adapted physical activity programs, cognitive and fine motor rehabilitation tasks to be conducted in controlled environments. The pilot has been defined according to the GDPR management for the data collection and maintenance, and also it has been approved by the CNR Ethical Committee. Okay, so we mainly refer to two environments. The first one is the home, where we select a kit of commercial devices to provide to those users. And specifically, we select a commercial smartwatch, a sleep analyzer that is a sensorized mattress to be put under the mattress in the bed, and a smart scale for body composition measurement. And we developed internally an ad hoc indoor localization system based on Bluetooth low energy beacons to monitor indoor habits. This is because the data that we collect from the commercial devices are not enough to describe the real activity of the user, and the indoor localization path are important also to have some evidence about the sedentariness of the user, but also of possible social isolation. We also developed a customized mobile app to collect additional information that help us to collect a labeled information from the user and the clinical ask us to integrate also this app with some question about the psychophysical health and well-being of the user. Then we added these guided activities. These guided activities are mainly based on adapted physical activity, but also some specific training that researchers developed inside their lab. Where we do this type of activities, we have a gym inside the CNR area in Pisa that has been developed in previous research projects on active and healthy aging. And it is equipped with several devices to make the physical activity. And here the user can follow a course managed by personal trainers, and also they make some additional training related to the balance monitoring using a sensorized mattress where they make some specific rehabilitation exercise for the balance, some serious games for the cognitive rehabilitation based on the use of a humanoid robot, and also fine motor rehabilitation by the use of lip motion sensors. To make the pilot a reality, we established a collaboration with a CSI-SD association that provide us the personal trainer that follow the user when making this type of activity. So, the pilot study has been defined together with clinicians to try to evaluate and validate also our algorithms that are able to collect and analyze the data we defined. And it is organized on 6 months length. So we defined the different study groups that are enrolled in the study for 6 months. The initial three months, they have been equipped with all the devices inside their home, and they participate twice a week to the program in the gym, and they make an initial clinical test, and they have some follow-up test after 3 months, and then they have also the final evaluation. What we are working on as a researcher is in the middle. After 3 months, we would like to validate our AI algorithms based both on the single domain data, but also on the integration of the different domains. Where we are now. We started on April 16, launching the project with a public event. Here you can see a crowded room with people that are there to the call. We received about 120 participation requests, and we started with an initial phase of 2 months involving 23 subjects. This was just a preliminary pilot because we have to set up both the collaboration with the personal trainer association and also all the device ready for the evaluation. Now, just today, they're starting the second phase, and we select additional 30 subjects involved for 6 months. Then we will have a third phase, and we hope to have also a fourth phase, so reaching more than 100 people involved in this study. And we are continuously enrolling control subjects that should be at least the double of the size of the first group. So, what we have obtained for the initial phase. So the initial 2 months have been used both to test the system, but also to understand what is the impact of this type of technology on healthy older adults, because some of them already knows of the technologies. These devices are commercial devices, so they know they are available, but they're not so used to use these systems, and also they don't accept often the personalized suggestions that are given to them. So we provided them we made a SUS evaluation, and this demonstrated a good user experience and a positive impact of the system we proposed. Only one person participated to less than 50% of the requested activities, so most of them are very happy to participate and very happy to be monitored and to receive our support. Most of the participants already present an improvement in their physical performances that have been demonstrated by the clinical evaluation, but about 30% of those users, even though they have physical performances that are much higher than the average of the population, they declare to have worsening condition in the sleep and the nutritional aspect. So this type of effect has been validated also by the data that we collected by the sensors, and we are working on the analysis of this data additionally to validate the relationship between the physical activity, the sleep, sedentariness, and body composition towards the condition of the user. The pilot phase 2 has just started, and we are working towards preparing the data sets, because the problem is that we are still lack of very large data sets collecting all this type of information, and we need to use this data to validate the single research activities that we are making on the prediction of the early risk of the aging condition, and also on the personalized support. So I'm finished. Thank you.